Downtown Seattle, a mentally ill man refuses to get off a metro bus or steals a candy bar from a convenience store. Even though it's a minor offense, until now, police have had few options.
These people who go off their medications or are having issues, they do something that brings attention to themselves. They get loud, disruptive. Regular citizens become concerned. They don't want to deal with it, obviously, so we get called, we come in, figure out what the situation is, what's going on. In the past, it used to be you had to arrest them. If they committed some kind of a crime, really the only thing we could do was to send them to jail.
Now there's another alternative, the Crisis Solution Center, a 16-bed short-term facility designed to stabilize people experiencing a mental health crisis.
What the Crisis Solution Center allows us to do is when a police officer encounters somebody who's committed a minor offense, but is obviously having symptoms of mental illness, to bring them to a place that can offer them a helping hand and a way out.
At the center, the person receives mental health counseling, medications, and services to stabilize them.
We can start working with the person. We can see if we can identify some needs that they have, housing, mental health services, substance abuse treatment, make sure that they get those services, and hopefully break that cycle.
Until we opened this center, our bad options were jail, which was expensive and slow. People got out, they were worse off. It was the emergency room at the hospital, which was expensive and not helpful, and it took beds away from people who had medical emergencies, and the streets. And we know the streets are not the default system of choice that we should have for the mentally ill either.
Now the center offers a voluntary therapeutic alternative.
We don't take people into the Crisis Solution Center who have been involved in the commission of major felonies. We don't take in people that are doing violence to other folks. These are basically minor misdemeanor offenders, but they languish in jails. They repeatedly cycle through our emergency departments, and the principal problem with them is not criminality, it's a behavioral health illness.
The center is expected to serve more than 3,600 people a year. It's funded through King County's Mental Illness and Drug Dependency Action Plan.